So thanks everyone for coming. Tanya and I are really excited to be here and of course to be representing each of our groups. The title of our session today, as Maria said, is Research Services and Support. So let's go ahead and get started. Tanya, can you advance the slide?
Sorry, I thought I hit the button.
No worries. So here are learning objectives for today's session. So Tanya and I will each take some time to talk about the resources provided from each of our groups, HEART and CBHDS. And so in our discussions, we'll provide an overview of the types of projects that we support and discuss how to get in touch with us. And along the way, we'll discuss ways in which our groups may work together to ensure that you are receiving the support that you need. I just want to say at the beginning of this that our groups do share some overlap. We do have overlap in our expertise in areas of support. But after today, we hope that you'll feel more confident in selecting the group or groups that best are suited to support you in your work. And ultimately, what's most important is that you receive the support that best fits your needs, no matter which group that you choose to work with. And so with that, I'm going to pass over the baton to Tanya so that she can talk about HEART.
Thanks, Alicia. So, Health Analytics Research Team, also known as HEART, is designed to provide you an end-to-end support. We have 19 team members, and that's including our director and our assistant director. Or actually, she's technically a manager, sorry. And then we work with grant-funded and institution-supported projects. We have a lot of healthcare research experience over time, we're going to talk a little bit more as we get through some of these different slides about what does it mean by end-to-end support. And we are a component of the NIH CTSA iThrive Birdie Group. And we also work with the innovation department to support app development. So there's a lot of different things that we work with in terms of the research here at Carilion. And so that's kind of what I wanted to share with you a little bit today. This is a beautiful picture of our team. We are a little bit all over the place, and we originally were all housed basically here in Roanoke, but there's a few of us now that are in other areas such as Richmond. We have one that lives in Alabama, so we're spread out a little bit more, but the majority of us are here in the Roanoke area, I mean. Okay, so what does it mean to be end-to-end research support? We want to be there with you to start talking about your study design from the very beginning. So we want to help you to build out your research and talk you through what does that look like in terms of what is it that what's your research question? Where are you going to collect the data from? Is this going to be a retrospective analysis? Is it going to be prospective? Do we need to help you build out survey questions and things like that? What type of data do you need? So we're looking at whether or not you need to do an extract out of Epic, or are you going to do a chart review yourself? And part of that discussion is or part of the decision to do an extract and or to do chart review may not be clear to you, and that may be something that we need to actually have a conversation about, which is why we really want to be involved at the very beginning. Because it may be that some of the information that you have or that you think is clearly defined in an Epic record may not be. It may actually be defined in a note somewhere. And then the notes are sometimes harder for us to pull or sometimes cannot be pulled. And therefore, it does definitely need to have a chart review. But those are conversations that we would work with you on from the very beginning so that we can define how we're going to go through the project and how we're going to help you be successful with the project that you're trying to create. We also can provide during that design time power analysis and a feasibility. So we use Trinetics, which is connected to our Epic data, as well as data from various other sources. But we can use that Trinetics query to determine how many patients do we have in our data set that would match the items that we're looking for your study. It gives us a better idea of, do we need to then reach out further outside of just Carilion and do more with our research services that's embedded into the Trinetics, but with different hospitals and different resources that's there. But those, again, conversations that we would love to have with you from the very beginning. If you need any additional support in survey building, we can build out the surveys for you. We can help you define what they look like if you have additional survey questions. And then also whether or not you need Epic research access. So as we're working with you, maybe you need to be the one that goes in and looks at the screening tool. Maybe you need a screening tool. And so those are some things that we would help you or work with you on in terms of building out that screening tool for Epic, giving you research access to it and to the Epic records, and then also making sure that we can help you identify what it is exactly that you need. We also work with TSG on part of the screening process or the screening tool that we build. So it's a little bit more, it's a combination between the health analytics team and TSG at that point. So then the next step is the data piece. So we've already talked to you then a little bit about your data. What are your data needs? What are you looking for? But then the next step is actually getting that data for you. So we've designed the project. It's gone through the IRB. We've helped you discuss all the different ins and outs of it. And part of the reason why that's important is because you may have an idea on what the data looks like. Like I said, I'm working on a project, or I've just got through working on a project, I should say, where the orthopedic department needed to have a specific thing pulled. They were looking for very specific procedures. So they had CPT codes that they were looking for, and they provided that for us. But when we got into, and it was a retrospective data pull, so when we got into the data and looked at it, what ended up happening is we realized that it may need to come from billing. It may need to be records that we query based off of the surgery that was being done, so the surgery log, or it may also be built off of other areas that we need to consider. So maybe it's the HAR record, the health record for the patient. Sorry, the hospital record for the patient. So because of those different things, we realized that we were missing people if we didn't pull it from 3 different areas. And so that was one of the things that we had to go back and do. We would not have known that had we not worked with the client at that particular time to talk through what exactly do you need, and can you give us an example of one of the records? Or if I give you a person, can you tell me why this person should be included or excluded? And then we worked with them to be able to identify exactly how to pull this data so that we would give them all the records that they needed for their project. So it's a little back and forth at the very beginning. And again, that goes from the design, it goes into data. But if we haven't had the design discussion with you at the beginning, sometimes it takes a little bit longer because we're having to pick that back up in the data side when it's already been approved and there may need to be changes to the IRB, because you may have identified fields that you were going to include, and now you realize that you needed to include different things. So all of that goes back into just having the conversation and allowing us to help identify the parameters for your project. We also then take that data, keep it in secure environment in REDCap, and we also have a secure cloud-based data storage known as Spark. We'll talk a little bit more about that one in a minute. We can also create the surveys and the distribution process where we can send alerts to the team members when people have responded to the surveys in REDCap. So, and HART manages all of the REDCap for Carilion. So anytime that you have data or you have any issues with with REDCap, or if there's something that's not working appropriately or any of those types of things, then please feel free to reach out to us because we would be able to help you with that and we would be able to get you into the right place for that. After the data has been pulled, we then would help you with the analysis part of that. We have data stored in Spark, and if you wanted to work on some data analysis on your own, we have in Spark, SAS Studio, we have RStudio, we have Python, NVivo, ArcGIS, and the Genius is kind of new right now. But all of those things are available within Spark. It allows us to work with outside collaborators more easily and keep the data secure. But we have our team can also help you with analyzing the data if you don't want to do it on your own. And then we also then would help you with presenting the findings and creating the posters and the manuscripts, like especially working on the parts that are more related to statistical analysis or the methodology. So when you go into the IRB and you are requesting services, one of the things that you'll get to in our Carilion IRB is what are the HART resources that you are requesting. So you can select biostat support, you can select data extract, and again, that goes back to some of the things we've already talked about. Epic Research Access, is there someone that's going to need to go in and look at the charts for chart review? Are you going to need to have some Epic Research build, like such as billing grids, screening reports? Those are things that you can select. The My Project Path, I'm going to go into in a little bit more detail, which will give you a bit more information around various different topics within Carilion and research. But we'll talk about that one in a minute. You can also select where you're going to have REDCap used. You can save your data in a shared drive or a Spark data set. In Spark, it allows us to have outside research collaborators. So that's why it's called Storage and Programs Accelerating Research Collaborations. That's where Spark came from. And it's also a secure research environment. So we would take the data, and let's say you already have the data or you selected REDCap, we can download the data for you from REDCap and then upload it into Spark so that the external collaborators will have a secure place to work on it. And we do have the resources, the statistical technology to work on it within that environment as well. The shared drive is also available for projects that are going to be used within the Carilion environment, and we can share data in that environment as well. And then we also have where you can access Trinetics or ask for Trinetics support. So those are all the things that you can select when you're going through the IRB protocol. Another thing I want to add is because if it is a Carilion project with Carilion PI and Carilion data, when you're going through the IRB, the HART team does not need to be identified on the protocol or added to it. So it goes back to we have most of us have already have gone through the city training, but it's not a requirement because our job descriptions allow us to work with the data, look at de-identified, full on data because that's part of our projects and part of our job description. So we don't necessarily have to be added to your IRB to be able to see your data, pull your data. And therefore, if you want to be a PI that is completely removed from having access to the data because you want to be blind to it, then we can do that work for you behind the scenes where it stays still private and it still follows the IRB protocol for you. This is our link, and I think someone's going to put that in the chat for us, but this is the link that actually takes you to our website from Carilion. So this is our Carilion Clinic Health Analytics Research Team website. And this is Riverside. So this particular website allows us to give you a little bit of information. And again, it goes back to where it has that link to the My Project Path. And we're getting ready to talk about that in just a second. But it has a link to the My Project Path from this website. And you can also save the link or also use that particular link later on as well. You can save both of them, but this gives you a little bit of information. Also, if you are interested in getting Trinetics experience, or if you need to get training in Trinetics, this website that you're looking at right now would have information on the Trinetics trainings that are coming up, or links to Trinetics trainings that are coming up. So I only have copied in like the first part of the website, so that way you can actually go and look at that if you needed some more support or training on Trinetics. So this is what the link to the REDCap My Project Path looks like. This was built in REDCap, and that's why it says it has a REDCap link to it. And the My Project Path is a virtual assistant to help you navigate research and QA/QI projects at Carilion. So I'm going to start by just showing you what each slide looks like in terms of what the actual screen would look like. So when you were to, if you were to click on this or open this link, this is the first page that you would get to. You can automatically just click on continue to topics. You can click on one of these and say, I want an interactive PDF. You can, but that's not going to give you the interactive ability to go through all the website pieces that I'm getting ready to share with you. So just clicking on continue to topics is the right way to get into the actual website to be able to see some of the different pieces. This is just one of the examples of what a screen will look like. It is not the opening screen, but I just thought since I am the biostat, I would just share what the screen looks like. But you can see that when you land on a page, it is going to show you information about that particular page. It may provide additional links or contact information, but this is what one of the pages would look like. The information that you would then need to be able to move forward into new areas is this topics up here in the top right. So when you click on this topics, it's going to open to something that looks like this. And again, this is just a screenshot of that. And what each one of these shows is you can view a topic by clicking on the button, and it will say project types. So this particular button, if you were to click on it, would take you into a website. All this is technically in REDCap, so it's not technically a new website, but it'll be a REDCap sheet that will show you all the different types of projects that we support at Carilion, research, QA/QI, and give you a lot of information about maybe other pieces of information that you might need, other resources that you might need, information on what happens if you have an external collaborator, those types of things. And then if you were to click on that page, you would have that topics in the top right-hand corner. So all of the topics go back to this top right-hand corner. You click on that and it'll take you back to this page. Then you could pick something else. So we have how you go for approvals. This is the biostatistics support through HEART. That was the first page that I shared with you. In case you have case studies, what does clinical trial support look like at Carilion? This website or this REDCap link is actually very, very helpful in terms of sharing a lot of information about what does research look like at Carilion. It's really important for us to be able to give you as much information as we can, because everyone ends up having the same kind of questions over time. So we've tried to capture all of that information in one location so that it's an easy place for you to go to gather answers to your questions, or to at least find out, do I need to contact someone else? We've also worked with some of the other areas to get information about, like the HRPO and the IRB. There's some FAQs here that you can look at. And so there's other resources that we have asked and reached out to and asked them to give us information so that we can put it here to allow you to have a one-stop shop, so to speak, to be able to get more information for your research projects. There's also a cost estimating estimation and funding. So you may be interested in what happens if you want to do a little bit of funding. If you have some funding and you're trying to figure out what it looks like to use Spark, REDCap, Access, those types of things. And there's a way of estimating that cost here. So if you were to click on this topic, it would take you to that page and you can go through the process of estimating what that would look like for your project and get a better idea of maybe how much funding you would need. We also have information about data sources, disclosures. When Epic came online for Carilion, not everything came online at the same time. So the data that we have for medications and the data that we have for other things came online into Epic at different times. And so it may be if you're doing a project and you want to query something retrospectively that has to do with medications, then there's a time frame that you may need to know about to say, okay, I can't go any further back than this because this is the information that we have available in Epic based off of when we brought that information into Epic. So there's some information like that that's available as well. There is a topic on working with external collaborators, and it walks through our School of Medicine students have some exclusions because where we don't have to like add them to different things, whereas sometimes if it's a Virginia Tech resource or collaborator that's not related to the School of Medicine, they may have additional pieces of information that they need to share with us to be able to make that connection stronger and also to make sure that we're giving everybody the correct and appropriate guide is not the right word, connection to the projects that they need. All right. So after you've gone through the My Project path and you've looked at some information and maybe you end up with additional questions, we would love to work with you on project design, feasibility, and so forth. We have drop-in office hours. So every Tuesday from 10 a.m. to noon, there's a link here. And maybe we can also get that link to you as well. But that particular link, it's not a very pretty link, it's very long. But that particular link will take you to the office hours. So once you click on it, it will allow you to drop into the office hours and from 10 to noon every Tuesday. If that doesn't work and you need additional support, or maybe you're worried that you don't have enough time to talk to us during that 2-hour window, or maybe it just doesn't work out for you, please feel free to send us an email and we will be happy to set that up for you in the future. And now I'm going to move this over to Alicia.
Thanks, Tanya. There is a question in the chat. I'm not sure if we cover this later on, but there's a question of someone who's a researcher at Radford with an affiliation at Carilion and whether he would be eligible to work with HART.
Yes, so I think I think the short answer would be yes. It may be that we would need to get you, if you have Carilion access, like a Carilion email address, those types of things, it may be that we can actually just go ahead and have you get started working on it. But it would also require, or it may require a Carilion PI. So I think it just depends upon what your credentials are and what your access is, but we can work with you on that. If you send me an email at heart@carillionclinic.org, we'll be happy to make sure we check into that for you.
Great. Thank you. All righty. Now to talk about CVHDS, that you can move forward, Tanya.
Thanks.
All right, so the Center for Biostatistics and Health Data Science, or CBHDS for short. So our center was established in the summer of 2019 to provide strong quantitative support for researchers at Virginia Tech, but also beyond. And so our mission is to achieve excellence in our research portfolio by fostering collaborations across disciplines and providing expertise in statistics, data science, analytics, programming, and data management. We also provide mentorship and educational opportunities for students and for junior investigators. And finally, we are located on the first floor of the newest building on the Health and Science and Technology campus in Roanoke, and that's Riverside 4. Next slide. So this is just a picture of our beautiful building. So this was completed in the summer of 2020, right in the middle of the pandemic. And so our team's huddle room has views of the Carillion Clinical offices. So it's right across the street, and we can see that from our windows. And we also get a really nice view of the Roanoke Star, which is really neat. And so next slide. And so this is my CBHDS team. And so we are currently a team of 15, consisting of 6 full-time PhD level team members, including our center's director, Dr. Alex Hanlon. And so we have expertise in biostatistics, epidemiology, statistical programming, data science, language learning models, and bioinformatics. JD Data, at the bottom of the screen on the very last row, he's an affiliate faculty member from the Department of Statistics that works with Missy, our bioinformatician. And so we also have 3 master's level biostatisticians, including myself, as well as a bachelor's and a master's level data scientist. And we have just one student from Virginia Tech's CMDA, which stands for Computational Modeling and Data Analytics Program. And last but not least, we have, of course, 2 administrative staff members, and those one of them is a business manager, a grant specialist, Amanda, and fairly new is Crystal Founds, who's our operations coordinator. Slide. All right, so what is it that we do? Again, that there is obviously overlap between Heart and ourselves, but we do provide expertise to projects led by Virginia Tech researchers, but also beyond that, we work with external folks all of the time, including folks from Carillion. We collaborate with investigators on matters related to study design, power and sample size estimation, grant proposal writing, statistical programming, data visualization, maybe planning your statistical analyses, um, actually performing those data analyses, as well as abstract and manuscript submissions and much more. We also provide data management services, including writing data management plans, designing REDCap databases, and so on. We also deliver educational workshops and webinars such as these, also engaging informal teaching, mentoring, advising of students and their dissertations and theses. Next slide. So this is just a really long list of kind of the things that we have experience and expertise in. So of course we have experience and expertise in classical modeling, Bayesian modeling, as well as more data-driven contemporary methods. So things like machine learning, neural networks, and AI. We engage in important and interesting projects with our collaborators, including those that involve dimension reduction, latent class analysis, longitudinal data analysis, mediation, and moderation. And more frequently, we're seeing bioinformatics requests for bioinformatics support for different like omics, so genomics and proteomics projects. And our bioinformatician actually has experience in all of those and has been supporting those projects now. And we also employ various programming languages, so SAS, R, and Python being our most prominent and strongest. We help to create, as I said before, maintain and create and maintain REDCap databases. And finally, we work within a Git environment to help support reproducibility and collaborate amongst our group within a team science framework. Next slide. So within a team science model, we do serve as short-term consultants or long-term collaborators. And so for short-term consulting, we offer Zoom drop-in hours 4 days a week, which are appropriate for questions that can be answered in less than an hour's time. And so our drop-ins are supported from different sources, including the Fralin Life Sciences Institute, or FLSI, for bioinformatics hours, the Virginia Tech School of Medicine for medical student hours, and then by our iThrive CTSA for general drop-in hours, which are open and free to anyone. And we do obviously encourage longer term collaborations in the spirit of strengthened partnerships in science, and for single projects when possible. And and Tanya talked about this as well, is that what we strive to do is really work with investigators from the very beginning, right? From study design through data analyses and then through the dissemination of results. It doesn't always turn out that way, but it is what we encourage and what we strive for. And our goal is to transition from project to project with our collaborators and hoping to build entire programs of research with our faculty members and beyond. Next slide. So if you are interested in working with us, I do encourage that you check out our website. This is a screenshot of our homepage. And if you pull down in the top right corner and you can see the arrow that is in the right-hand side here and scroll through, you'll find, different little sub pages here, our welcome page, an objectives page. There's a whole bunch of resources in there that are available if you need, our training or any, knowing more about our CTSA and so on. And then on our service page is where you will find a link to submit a request for collaboration. So we do have a request system in REDCap, which I'll show in a couple slides over. If you, again, to submit a request for collaboration to work with us. Next slide, please. So on our website, you'll also find a process page, again, that you can access from that sort of sidebar, where you'll find, so the process page essentially describes our collaboration process. And so this slide shows a screenshot of that process page. So this is the top of the page, and we provide essentially a set of documents very similar to the My Project Path at Hart, where we do have a set of documents of things that were always asked. And this is, in combination with our frequently asked questions. We have a separate page on our website for questions. But this set of documents helps to outline guidelines for data preparation, how to work with us during, grant proposal writing, manuscript compilation and submission, as well as guides for working with our bioinformatician, for example, and how to get started if you are using a high performance computing platform, ARC, at Virginia Tech. There are ways to start there. So we do have quite a bit of resources to look through, again, based off of requests and things that we've gotten from people in the past, that the general sense is people really don't know how to work with us from the start. And so this is a way for us to provide you all with resources to kind of get you started and to know how to prepare for that first meeting with us, for example. How would you work with us to prepare a manuscript and so on. Also on our website, we have, again, as I mentioned, a long list of frequently asked questions related to working collaboratively with the statistician. And so those questions, in combination with these documents here, address things like the differences between consulting and collaboration, authorship guidelines and expectations, as well as lead time expectations, our collaborative process, and so on. But you can advance on the slide, Tanya.
Sorry about that.
No worries. So here is a screenshot from our Zoom consulting hours page on our website, which can be directly accessed from that homepage. It should lead you straight to here. And so our general hours for drop-ins are Mondays from 10 to 2, as well as Wednesdays from 3 to 7, so that we can accommodate clinical folks that have busy daytime schedules. And Tuesdays and Thursdays are specific for medical students. And so if you're working with medical students and have specific questions, and they haven't been assigned a mentor, so our team is funded by the medical school to work very closely with medical students. And so we help them with their research projects from beginning to end. So through the design, and helping them through data collection and analyses. And oftentimes that may include getting Hart, on board as well, if that involves extractions of EHR and so on, and getting access to the data. So there are times in which we will work with Hart, of course, in these things, but medical students, we do help. We are funded to provide them with support on their projects. And at times students don't seek out our support, and it usually is because they simply don't know that they cannot reach out to us or feel that they can handle it themselves. But it also is good for the mentors to also know that we are available as a resource at no additional cost to help assist students with the research projects that are required for their graduation and for their program. Um, so yeah, I think that's it on this slide. Thanks. So if you are interested in working with us, you can reach out via email directly. Again, we'll have contact information at the bottom of the uh, email that you can use. You can also reach out to me directly, or you can submit a collaboration request form that is found on our website. And this is just a screenshot of what that looks like. So there are various places all over our website, even in the FAQs and places where, you want to submit a request, it'll always lead you back to this request form, and you'll essentially fill this out, specifying, what your specific request is and so on. And we usually try to get back to you within 24 hours to make sure that um, you know, we're not stalling your work. Next slide. And so one thing I do want to note, and I think this is my last slide here related to our center, is one distinction from HEART is that CBHDS is built on a hybrid business model, which was intentional for sustainability based on guidance documents coming from our colleagues that also lead similar academic help centers such as ours. And so we are supported by a variety of funds, like institutional funds, federal funds, from NIH and NSF grants, for example, contracts and awards, both internally and externally. And so I do want to make it clear that we're not specifically a fee-for-service model, but we do, and again, we'll talk about this in a couple slides over about how you go about choosing one resource or, few resources over another. But again, making it clear that we are a soft-funded center and do, require funding to a certain extent to work with you all. Okay. So with that, and with all of the information that we've thrown at you, we'd like to summarize this. And Tanya and I, again, thinking about this, it is a bit complicated, I think, and I think we have hopefully clarified how to best select the resources that will support you and your research needs. And so this really relies on two things. The first and most important is really what kind of support you're looking for. And secondly, whether you have funding to support your project or not, right? So if you advance to the next slide, Tanya. We created this nice little figure, so I'm going to try and walk you through this. And of course, Tanya, please feel free to jump in. So if, and very, very simply, essentially the gray boxes here indicate the kind of support that you're seeking. And then the arrows that follow on the side are really what your options are in terms of seeking support for certain, from each, either one of our groups or both, right? And so if you are seeking, we'll start at the top. If you're seeking REDCap support and you really have the option of working with HEART, where no funding is really required to work, so long as, again, you are affiliated with Carilion. You also have the option of working with us at CBHDS. Again, if the project is not funded, we tend to be very creative and trying to support folks as best we can. We can also work with you through our drop-in hours, which again are supported through our iThrive CTSA, or we can provide long-term support if there is funding available, right? And so the same, I think, can be said for requests that are involving data analyses, whether that's, classical modeling like regression or hypothesis testing, as well as those for other data-driven approaches like machine learning, right? Both of our groups can support you in those ways. Again, it really drops down to whether or not you have funding.
Yeah. And I would also add to the REDCap piece, especially, it may also depend upon where your data is coming from for the REDCap piece. So if it's if it's Carilion data that's going to be stored, the majority of that needs to be in the REDCap with us. if it's surveys, things like that, then there would be, or other types of data that you're getting from other resources, registries and so forth, then again, it can be the CBHDS group as well.
Mhm. Great, thanks, Tanya. And so if you're interested in submitting a federal grant, right, from the NIH, NSF, our team at CBHDS has tons of experience that is built into our business model. That is how we're, funded mostly. And so our team does not require funding to help prepare the statistical methods section and to perform power and sample size computations in here. This is our exception. Again, that is through coverage of our CTSA. We do the grant preparations in kind. However, we do ask that members of our team are written into your grant as collaborators or co-investigators. And that is really the only caveat there. So that the only catch there is that, yes, we provide in-kind support for grants, but we do have to be written in as, again, collaborators or co-investigators in here. And although that's not listed here, we have also worked closely with HART, and HART does help to support grant preparation where there is EHR things involved, right? And so we have worked closely with them on those types of submissions involving EHR. And so HART can assist with ensuring, as Tanya was explaining, project feasibility, estimating power and sample size. So we can work closely with HART if your project, again, if it's a federal grant, and it involves electronic health record data, we can work closely with HART on this and have done this seamlessly before.
Yeah. And I would just add that the HART team also, we have some experience working with grant writing. We have some experience with Carillion having grants as well. But the federally funded grants are probably going to be more in line with what CBHDS has done. But we do have a grant section at Carillion as well. And Vera is one of our contacts that we have at Carillion that will help with identifying and helping us complete filling out the process for some of the grants. So there is, I don't want it to come across that there is no grant writing processes at Carillion, because there is, but for the federally funded grants, sometimes having this academic partner is very helpful in terms of moving those things forward.
Okay. Moving on to the next one. So if your project requires expertise in very specific areas like epidemiology or omics, or involves some sort of novel methods, you can certainly seek support from CBHDS. Again, if the project is not funded, we can work creatively with you through our drop-in hours, or again, can provide long-term support with you if there is funding available. And lastly, if you are seeking support in, Epic extractions or QA/QI projects, those are certainly things that CBHDS cannot help you with, and HART can support you with no funding required. Again, as long as there is a team member that is affiliated with Carillion on the study team. Anything on those two last ones, Tanya?
I don't think so. I think you said that very, very well. So if there's any, again, this goes back to sending us at heart@carillionclinic.org, just sending us an email, and we'll be happy to work with you on that, or set those up in terms of, we can also some of these can be started even during the office hours. So if for some reason you want to jump into an office hours meeting and we decide that there may be more information that's needed, or it's going to be the scope of this is a little bit larger or more time consuming, then we would just schedule something outside of that. But we are happy to have you drop in, and sometimes people just want to talk through an idea, and that's what we would hope that you would use that avenue for.
Yeah, I also just want to note too that whether you reach out to CBHDS or Heart about your project, we're always happy to guide you in the right direction if we feel that the other group can better support your needs, or that perhaps you need to reach out to Heart first and then we can connect when you're at a certain point. Again, so there is no right or wrong place to reach out to first. Again, we work very closely together enough to recognize where we don't have, the expertise or are able to support you in any way. I do want to make sure that we note that. But yeah,
And I
so
concur.
exactly. So I think with that, we can wrap up with our contact information so that you all can get in touch with us. And so I think we can now open the floor up to any questions if anyone has any.
Fantastic. Yeah. Feel free to unmute and or put a question in the chat if you guys have something for Alicia or Tanya. I don't think we missed anything in the chat so far. I think you guys covered the one question.
Yes.
But anything else? I will echo a comment from the chat. That diagram that you guys outlined, with who specializes in which area, recognizing that there's a lot of overlap in what you guys do and that you can go to either group for what you need. But I think that's extremely helpful because I think that's one of the things that folks struggle with is knowing, who to reach out to, what their project looks like. Oh, I'm doing med student focused, I'm doing EHR focused things. So I don't know if you guys have that available online somewhere, but I think it answers a lot of questions for me.
Good. We don't, but I do agree that we probably should post it somewhere on our website. Um, I think Tanya and I were talking about that as we were sort of trying to develop it because you're absolutely right. There's always question about, well, should I be going to Heart? Should I not be? And I think it would be good probably to post it somewhere. We can figure that out. Yeah.
Absolutely. Lots of comments about how helpful it is. That decision tree, definitely a useful tool. So,
Mhm.
any other questions or comments? All right. Well, if there's nothing else, because you guys must have covered everything, so clearly there are just no questions, which is amazing. And it sounds like lots of folks are going to be reaching out to you guys. So, I know you guys are prepared for that, but I know that Dr. Locklear and Alicia, I'm sure, would be welcome to fielding any questions over email or phone call. So, make sure that you feel free to reach out. And thank you guys for joining us today. Our slides and the recording will be posted on the OCPD website here in the coming weeks as a resource. So encourage your colleagues, if they were unable to join us, to take a look at that. And have a wonderful rest of the day. Thank you to our wonderful presenters.